speak around all these issues, let's talk about some of the myths that is also affecting maternal health and resulting to mortality. We talked about educated people, yes, but there are some educated people who will never have a cesarean section. They'll tell you that maybe by virtue of religion, you want to be like a Hebrew woman. That's what they call it, something like that. They tell you women who have cesarean sections are not real women or something. So I mean, they would do everything, no matter how risky it is for them, to have a normal delivery. She talked about family planning, for example. There are women who will never go for family planning. They'll tell you, well, if you have family planning, you will never conceive, or I mean, all these issues are affecting at the end of the day. How do we change all of this? Because I mean, for some, it's been passed from generation to generation. Oh, my mother has 7 children. She had them naturally. Why would I have cesarean? I mean, your mother comes into the labor room and tells you, I had 12 children. So you too, you must go through this. It's normal. Speak to us really. How can we begin to change all of this? Just so that some of these myths, some of these beliefs, we change them and save ourselves and our babies.
Okay. Thank you very much for that. That's really very insightful. So one of the ways to take care of these myths and misconception, it's right from the beginning. Girl-child education. Education cannot be overemphasized. Once you educate the girl child, once you educate a woman, you're educating the whole community. Because once you educate the girl child, she will take charge of her health. She will know that this is her right. It's not a luxury. So knowing that I am sick, I need to go to the hospital, listen to my doctors, do what is that's asked by the doctors to be done is something that is very important. So education is very important. Second thing, it still goes to empowerment. Empowering the woman, it's also very important because sometimes they would have agreed to go for the cesarean section, but because of abject poverty, you understand, they might not be able to have access to those services. So once you empower them and they take their health as their own and they take charge of it and they take it as their own right, they would go to have access to all these services. And another thing that we can do to prevent this myths and misconception is involving the families, the communities. Very important. And then male involvement, because as I've mentioned earlier, sometimes they think if you are sick you don't go to the hospital. Maybe some of them will say, okay, you're a female, you cannot go and be seen by somebody else. You understand all those cultural problems that maybe a female has to see a female, gender dynamics and all that kind of thing. So that is, once you educate that, because health is wealth. You need to be healthy to be alive, to know that someone takes care of you before you say you're choosy about who is going to take care of you. And with the fact that we've mentioned earlier, there are even scarcity of these doctors. So you have to get the one that's available. So these are all part of the things that could help. Then, of course, increasing awareness, going to the community, giving some talks, going and involving other members of the community to make sure that you dispel all these myths and misconceptions.
Talking about talks, I want to ask what is going wrong. I'm speaking from experience. Many years ago when I had to use antenatal facility for the first time, and when I used it the last time, there was a huge difference in this talking you're talking about. I mean, the first time, the midwives, the nurses were excited about antenatal. They were given the right information. They had the time. They were patient. Is it that the economy or something has changed? I want, because these days, I mean, you walk into antenatal, there's no energy. Those days, women are excited to come for antenatal. There's no energy anymore. There's no, I mean, the talks, even away from maternal, whatever, if you go for immunizations now, they don't, I mean, nobody's educating anybody about anything. Nobody's willing to talk. They don't have the energy. They just tell you, I can't shout. The midwives just come and tell you, I don't have the energy, I can't shout. And then they just go on and do what they have to do. What is changing? Is it that there's no more interest in this, or there are other factors that is, affecting all of this?
So when you talk about interest, I mean, there are a lot of interest, because if you're a medical personnel, you take oath. So there are a lot of interest. A lot of people work with the fact that they like what they're doing. However, there is a lot of stress and strain. There is a lot of lack of manpower. By the time you know you're going to attend to 50 babies or 50 women, and you know you're going to do it within a short period of time, you might think you don't need to use a lot of time talking to these women. You better start seeing these patients almost immediately. But I'm so sorry, I don't know where you went to. They still give health talks. You understand? It might not be as detailed,
as explanatory,
exactly,
as interesting.
Yeah, it might be, but then maybe for within a short period of time. You understand? But then, of course, it all goes there because just as you're saying, yesterday I was in the clinic and our nurse was saying there was supposed to be like 5 nurses in the clinic, but she was the only one in the clinic, overseeing almost 50 patients. So something of 5 nurses, so say maybe 1 nurse to 10. So now she's doing for 50. So you can imagine, she's human. So she was overstretched. She was really trying, and the doctors were helping her, but she would not have that same energy. She had to take care of 10 people, maybe someone doing urinalysis, and she giving the health talk, and the work is going. Of course, you can't keep the patients waiting. Pregnant women, think of it, keeping you to wait for 2 hours, saying you're just going to have a health talk before you see the doctor is also another problem. So to be candid, really lack of manpower.
Well, on a lighter note, perhaps, you know, when on your first ever trip, it seems a bit more interesting. When you go that route over and over, it becomes less interesting. I guess that's the experience you already had